Patrick, welcome to the Health Path podcast. I'm really excited to be able to speak with you and pick your brain a little bit on the topic of essentially breathwork and breathing.
Yeah, of course. Good to be here, Alex.
Yeah, so I read your first book, The Oxygen Advantage. I think from memory, it was pretty much like with the first lockdown a couple of years ago. And obviously we had that beautiful weather. I lived next to a park, so I was reading the book, going for walks, trying the exercises. And I have a childhood full of mouth breathing. I experienced asthma as a child, which kind of naturally sort of healed, so to speak. But going through sort of the exercises that you created and using your work, it has had, as I'm sure so many hosts on podcasts you've been on have said, a profound impact on my health. And in particular, sleep is a big one, and how I feel in the morning in regards to productivity. And there's a whole bunch of reasons, obviously, that we'll likely kind of dive into in today's conversation. But before we do, are you happy, just in case there are some listeners who aren't yet familiar with you, just to share a little bit of your background and what got you into this?
Sure, Alex. Yeah, I was one of those people who was a chronic mouth breather, like many other people. And growing up with a child having asthma, and of course, when you have asthma, you're also more likely to have a stuffy nose, because inflammation in the lungs will travel up to the nose and vice versa. And when you have a stuffy nose, then your sleep is impacted. And I remember going through secondary school, I pretty much struggled with concentration and attention span, which is normal when you're not getting that optimum sleep. And I was very much living in my head as well. And I never considered myself having anxiety, but, I suppose it was just one of those things that when I look back, I got into university, I had to work really hard for it. And then in 1997, 1998, I read a newspaper article. On a couple of occasions, I came across the same content. And it spoke about the importance of breathing through the nose and also about breathing light. And it kind of resonated with me at the time because as I was reading it, I was a chronic mouth breather, but I was also a faster and upper chest breather. And that day I started using the nose and blocking exercise. So there's a technique to simply open up your nose by holding your breath. And I switched to nose breathing and I was feeling air hunger, but I stuck with it. I taped my mouth closed at night, but I also used nasal dilators to help open up the nose. And then the second night with my mouth closed, I woke up and it was the best night's sleep I had in about 15 years. Now I was in the corporate world because that was my training. And it was a couple of years afterwards that I really felt I wanted to change careers. And that was 20 years ago, like it's plus 20 years ago now, but I'll be teaching it full time for 20 years on the 17th of March, 2022. So, so it's kind of weird. Yeah, it's making me feel old now as I'm talking to you, but that's the way it is.
You've mentioned that concept of kind of light breathing. In your book, you talk about a sort of LSD breathing. So do you want to just kind of touch on these, I guess, sort of foundational components of what healthy breathing, so to speak, looks like, feels like, almost sounds like?
Yeah, healthy breathing is in and out through the nose. That's first and foremost. It's not in through the nose and out through the mouth. It's in and out through the nose. And healthy breathing is also light. During rest and during sleep, it should be pretty much undetectable. So that's what light breathing means. And it's very common for people to breathe a little bit harder and faster using the upper chest. And nobody will really notice it. I will look at it. I will notice it. You have to be kind of paying attention to somebody's breath to really notice it. But harder and faster breathing can throw us into that stress response, but it can also disturb the biochemistry. It's not only disturbing the biomechanics of our breathing, it disturbs the biochemistry of breathing, and it also disturbs the physiology and the psychology. So when I was first come across it, I remember practicing breathing less air. And this flew in the face of everything that I had heard to date about breathing back then. And I practiced really slowing down the speed of the breath coming into my nose, and a really relaxed and a slow and a gentle exhalation, and a soft breath coming in, to the point that I was under breathing. So I was deliberately under breathing, slowing down the speed of the breath in so much that I could feel hardly any air coming into my nose, and having a really relaxed and slow, gentle breath out. And within a few minutes, I could feel the temperature of my fingers improve. I always had cold hands and feet, and cold hands and feet are very common with people with, the technical term is dysfunctional breathing patterns, but say suboptimal breathing. And I never realized back then that the more air I was breathing, the more I was causing my blood vessels to constrict. The harder and faster my breathing was, the more I was activating a stress response. And I, at one point, was doing a finals exam. And I was, because I was a faster breather and an upper chest breather, it would have been a little bit more towards the tendencies of being stressed going in. And, it's normal enough. You're a little bit anxious anyway going into an exam. But I wanted to take a walk to clear my head before I went into the exam hall. And I remember taking a walk for about 3 to 4 minutes just to try and clear my head. And during those 3 to 4 minutes, I took these full, deep breaths. Because again, back then, that was what I thought was best. And I walked into the exam hall completely lightheaded. And it took me a while to get my composure back. It was exactly the wrong thing to do. There are so many ideas out there about breathing. And I think it's very important for the listener to, not necessarily to take my word at it, but to, if you can understand the basic physiology, that with human beings, we don't need to be breathing hard and fast during rest and during sleep. It's not ideal. And look at the people who are not well. Look at the people who are coming in and they're highly stressed. Look at the people with sleep disorder breathing, the people who are getting breathless just going for a walk. Their breathing is hard and fast. It's not a great sign. And look at the people then who are prone to panic disorder and asthma and anxiety. And very often they will be breathing upper chest. So they will have hard and fast breathing upper chest. No natural pauses after the end of exhalation, for example. Now, it's not just that our conditions, it's not just, we could argue that, well, the person with asthma feels that their airways are narrowed and they're feeling that they're not getting enough air. They have a sensation of breathlessness. So it's normal that they will breathe hard and fast to compensate. But we have to recognize that the hard and fast breathing is feeding into their asthma as well. It's like a vicious circle. And also the same applies with people with panic disorder and anxiety. So what is normal breathing, to come back to your question? It's in and out through the nose. It's light. So light means that it's almost undetectable during rest and during sleep. It's slow. So the respiratory rate should be normal. And normal respiratory rate is 10 breaths to 14 breaths per minute, maybe verging on 15 breaths at the upper limit. And deep breathing just means that you've got an optimal recruitment of the diaphragm. And I think, how many times have we heard the instruction to take a deep breath? And then I ask my students to show me when they first come in, show me the deep breath that you take. And they take this hard, fast, big, full breath coming in. That's not necessarily a deep breath. That's a big breath.
Okay. And am I right in saying that just through nasal breathing, there's sort of better recruitment of the diaphragm as well? So, it's kind of a double win, so to speak. If you're consciously breathing deep, but also breathing through the nose, you're really starting to get the best out of the diaphragm contraction.
Yeah, for sure, Alex. If you look down at your chest at the moment, and if you take a breath through your mouth, you'll typically see that mouth breathing is engaging the upper chest. Now, there's unfortunately, it's very understudied. And I often think of the professions which are encouraging their students and their patients to actively breathe low. But what they are overlooking is the importance of nasal breathing. I don't think we are going to achieve a long-term outcome teaching anybody to breathe abdominally or diaphragmatically. And basically all it means is that as we're taking a breath into the body and the diaphragm is moving downwards, we should have lateral expansion. The ribs should be moving outwards. We will naturally have some movement to the front and some movement to the back. And that's just meaning that we're breathing low. And also to go with the 80% rule, 80% should be driven by the diaphragm, 20% by the upper chest. But nasal breathing definitely imparts a greater recruitment of the diaphragm. Now, I'm not going to say that all nasal breathers have optimal biomechanics, but what I will say is that if an individual has been mouth breathing for a period of time, it's much more likely that they will be breathing hard and upper chest breathing. And also, there's so much going on with the diaphragm, and I know you're aware of it in terms of every time we take a breath and we have movement of the diaphragm, it's massaging all of the internal organs, it's assisting with lymphatic drainage. The diaphragm breathing muscle is also directly connected with the emotions. The diaphragm is providing stabilization for the spine. So, for example, as air is drawn into the lungs, there's a negative pressure created in the thorax, but there's a positive pressure created in the abdomen. And it's the movement of the diaphragm with functional breathing that assists with functional movement. So, for example, 50% of people with lower back pain have dysfunctional breathing. Now, is it lower back pain which is causing impaired breathing mechanics, or is it the impaired breathing mechanics which is feeding into the lower back pain? Regardless, any person with lower back pain, it's important that functional breathing patterns is restored. And chronic fatigue syndrome, fibromyalgia, a lot of these conditions can be impacted by sleep. And I know there's some connection between fibromyalgia and obstructive sleep apnea. Okay. And in 2021, January, I wrote a paper that was published in the journal Clinical Medicine. I wrote it with 2 ear, nose, and throat doctors, and it's exploring the dimensions of breathing from a biochemical point of view and a biomechanical point of view and psychophysiological to the phenotypes of obstructive sleep apnea. And as we get a little bit older and we put on a bit of weight, we will put a little bit of weight maybe on the throat, so it narrows the airway. We put weight or fat deposits on the tongue, so the tongue now is occupying more space in the mouth, which can encroach the airway. And when the airway is narrower, then it increases resistance to breathing. And then that can be contributing to, for example, stopping of the breath during sleep. But also when we put on weight, we put weight on the belly, which impinges the movement of the diaphragm. And the diaphragm breathing muscle is directly connected with the upper airway dilator muscles. So if we are breathing hard and fast and mouth breathing during sleep, the throat is more liable to collapse. And then if we're having obstructive sleep apnea, that can really mess up with hormones, such as ghrelin and leptin. And ghrelin will stimulate appetite, and leptin it affects our ability to know when we've had enough food. So in the human body, I know there's a habit that very often in healthcare, we split the human body into separate functions without actually realizing the bidirectional relationship between all of these functions. And I often use the example that how many times I've seen people coming in with depression and anxiety and panic disorder over the years. I asked them about their sleep quality, and their sleep quality is really poor. But when they go to their healthcare professional, they're being taught about cognitive behavioral therapy and mindfulness and prescribed medication. And all that, of course, is very, very good, but it's missing out on 2 things. It's missing out on functional breathing because 80%, depending on whatever paper you read, but generally 75 to 80% of the population with anxiety and panic disorder have dysfunctional breathing. So especially in that cohort with anxiety and panic disorder, we have to be investigating breathing and we have to be investigating sleep. But also then with fibromyalgia, we have to be investigating sleep as well, with chronic fatigue syndrome. Because again, in terms of recovery and bringing the autonomic nervous system into balance, the question to ask is this: if we continue to have sleep disorder breathing, is the body and mind going to recover?
Yeah, absolutely. I think it's just fascinating. I mean, we could spend the entire podcast just talking about the consequences of dysfunctional breathing. It really is remarkable. And one of the key things I think from all of this is something that you discuss in your book around how optimal breathing allows for optimal delivery of oxygen into the cell, and therefore the cell has some of the sort of prerequisites it needs to function well. So if we're thinking about fibromyalgia, chronic fatigue, we're talking about an energy deficiency at a cellular level, and that's partly related to the cell not receiving what it needs to function. So there are so many kind of connections that I'd love to kind of try and unpack with you there. The one thing that I want to touch on from a consequence perspective, if that's okay, before we maybe move into kind of the gases with oxygen, carbon dioxide, and that sort of side of things, is sort of the developmental side that you've spoken about a lot. So what happens in our children who are mouth breathers, for example. So are you happy just to kind of touch on that a little bit as well?
Of course. I think it's really important because it's very much overlooked. And there was a study by Karen Bonnock, and I think she's an American researcher. She did a longitudinal study in Stratford-upon-Avon, and it was published in the journal Pediatrics in 2012. She looked at 11,000 British school kids and followed them over a period of either 4 years or 6 years. But she concluded that children with sleep disorder breathing at age 5, if they were untreated, and this is including snoring and obstructive sleep apnea, if untreated at age 5, these kids had a 40% increased risk of special education needs by age 8. So she talks about it in her paper that you'll read, and I can send it on to you afterwards. And she talks about during the developmental period, the child's brain is growing. And in order for development of the brain, deep sleep is required. But if the child is snoring or if the child is having apneas, and it's very different, obstructive sleep apnea is different in terms of the diagnosis in a child and in an adult. So for example, an adult stops breathing for 10 seconds or more during sleep, that's an apnea. But for a child, it's when the child stops breathing for just 2 breaths, that's an apnea. And also in terms of the severity, when an adult has between 5 and 15 events per hour, that's mild sleep apnea, and 15 to 30 events is moderate and 30 events plus is severe. But in a child, it's 1 to 5 events per hour is mild, 5 to 10 events is moderate, and 10 plus is severe. So it's very different. No child should be snoring. And we shouldn't be hearing children breathe during sleep. And the other thing about childhood development is the gold standard of sleep with children with sleep disorder breathing is tonsillectomy and adenoidectomy. And the efficacy of it was first looked at in 2010. And it was published looking at 500 plus children by an author and researcher called Patrick. He looked at 500 plus children and he found that tonsillectomy and adenoidectomy, only 27% of the children had their sleep disorders fully resolved post tonsillectomy and adenoidectomy, and 73% of children continued to have sleep disorder breathing. Now, the other aspect is that Dr. Christian Guilleminault, who was considered to be one of the founding fathers of sleep medicine, he has written and spoken about that if you have a child undergo tonsillectomy and adenoidectomy, if nasal breathing is not restored during wakefulness and during sleep, there is a 65% relapse within 3 years. How many children in the UK is going into hospital today to have a tonsillectomy and adenoidectomy? And post-surgery, there will be no respiratory rehabilitation. There will be no attention paid whatsoever to how the child is breathing. And also, is there a follow-up sleep study done on that same child? And we have to ask the question, like tonsillectomy and adenoidectomy, it's not a walk in the park. These are not just statistics. This is a fairly, it's a little bit traumatic for both the child and the parents. Yeah. And why not get it right? Why not look at sleep from a broader perspective and not just to focus in on the tonsils and the adenoids? We also need to be looking at nasal breathing, but nasal breathing has been overlooked. It's the elephant in the room. It's the simplest and it's the cheapest. And it's for this reason, and I got very frustrated 20 years ago because I came from having chronic asthma and I know the effect it had in my own childhood. And because you're struggling with breathing, you're less likely to play sports, but I played sports, but I struggled. I struggled academically, even though I got my grades, but it took a lot of work. And it could have been easier. And I remember contacting various institutions and asking them, please investigate the importance of nasal breathing in asthma, because the nose is the only organ in the human body that serves any purpose in terms of breathing. If I open my mouth and say, if I was to explore around the mouth and ask, is there any part of the mouth that does anything to the breath? And the answer is no. The mouth is just not for breathing. That's the way it is. And the nose, by breathing through the nose, it increases oxygen uptake in the blood. It increases and helps to normalize blood gases, especially carbon dioxide, but it also slows down our breathing. So when we breathe in through the nose, there's a resistance to our breathing during the day. It slows down the airflow coming into the nose and it allows a relaxed and a slow, gentle breath out. And this is very calming for the emotions and for the mind. And this helps to bring that balance in the autonomic nervous system. That the gas carbon dioxide it stimulates the vagus nerve, but also nose breathing and slow breathing and low breathing stimulate the vagus nerve. And it can improve the sensitivity of the barrel reflex. So basically, we as human beings then are more resilient and we're in better balance. Whereas conversely, If, for example, you have a teenager and they have sleep disorder breathing, they're breathing a little bit faster and harder using the upper chest, what is that doing to the body? It's putting them into an increased sympathetic drive. And we as human beings, we can't cope with long-term stress. We're not built for long-term stress. We're well able to manage a short-term stress, provided we have good recovery. And why put the body and mind under stress? You know, physiologically, we have to look at that life will throw us certain events. And if we have a chronic stressor, a difficult situation, our breathing changes. But the one thing about our breath is that we have some control over it. And I was listening to a podcast by Dr. Rangan Chatterjee. He's a doctor based in the United Kingdom. And he was interviewing a brain surgeon called Dr. Rahul, R-A-H-U-L. You'll see it back in May of 2021. And Dr. Rahul spoke. He says, you can imagine now this doctor he's got a patient in front of them on the operating table, and that's a pretty tricky situation. Dr. Rahul says, when I get into a tricky situation, the first thing I do is prevent myself from hyperventilating. And I was just listening to this and say, of course, this good doctor knows this, but why doesn't everybody else know about it? Why doesn't the school child know about it? The teenager, the corporate worker, the family person, the sports person, and they don't. Because normally when we do get into a difficult situation, our breathing gets faster and harder. And then the brain is interpreting, well, breathing is faster and harder now, so there's a threat out there. So the brain is saying to the body, get the hell out of the situation. It's not a time for planning. It's not a time for decision making. It's a time for fight or flight. But say, for example, if we're aware of our breathing patterns and we do have a difficult situation, and if we bring our attention onto the breath and always think about the exhalation, it's not the inhalation. Don't worry about the inhalation. Focus on the exhalation. And if you take a soft breath in through your nose and a really relaxed and a prolonged breath out through your nose, just to allow the air, deliberately slow down the speed of the air as it leaves the nose. Then take a small breath in through your nose and a really relaxed and a slow, gentle breath out through your nose. Your body now is telling the brain that everything is okay, and the brain will send signals of calm accordingly. So we have this response that, yes, we know our breathing reacts to a difficult situation, but we can have control over the breath. Don't hyperventilate when you get into a difficult situation. Focus on the exhalation and slow it down.
Yeah, I think looking back to reading your book, when would it have been? Sort of March 2020. I think I have such a fond memory of it because of how I felt going through those exercises, and the exercises around just initiating a little bit of an air hunger. It's kind of meditative. You know, reading the book and doing the exercises, you do become very present and you do feel a sense of calm sort of come over you. So I can definitely sort of say firsthand that I've experienced kind of the effects of that sort of more functional breathing. With that in mind, you kind of mentioned obviously carbon dioxide being a core component of how we regulate our breathing. Ultimately, it's a key sort of trigger. Can you expand on sort of, I guess, oxygen, carbon dioxide and nitric oxide and the role that plays? Because I don't think many people have heard about nitric oxide, certainly in the public, but it has such a core impact on so many different areas of our health. I think it was in your book that I sort of was skimming through sections this morning. There was a relationship between, it was either between an element of breathing or just nitric oxide and even sort of erectile dysfunction, for example. So I'd love you to kind of just share this with our listeners if possible.
Yeah, of course. Nitric oxide is produced at different sites in the body. And the area that we focus most on is in the airways. So nitric oxide is a gas that's produced in the airways. It's produced in the paranasal sinuses. So these are the pockets surrounding the nasal cavity, and possibly in the sinuses as well. Possibly in the nasal airway, the cavity. When we breathe through the nose, we harness this gas, and we're drawing air with nitric oxide then into the lungs. And nitric oxide in the lungs will help to open up the airways. It will also help to open up the small blood vessels in the lungs to allow better gas exchange to take place. And it also helps to redistribute blood throughout the lungs so a better gas exchange takes place. Now, This gas was first identified on the exhale breath of the human being only back in 1991. So I suppose it's a relatively new gas, and the entire functions are not understood. But it's also antiviral and antibacterial. And we were talking about the importance of nasal breathing, because I was in London in February of 2020 when COVID first we're starting to hear the basics of it. And I remember being in a tube, and it was pretty packed. And here was I think to myself, well, this is the last thing I want. And I was there in the packed tube, and I did two things for the entire duration of the journey. I breathed through my nose, but I also breathed as little air as possible, because I figured that if the virus is airborne, why not reduce the viral load? Why not take in as little of that? And also by breathing through my nose, whatever chance my mouth has, whatever chance my nose has to prevent the virus from coming into the body, my mouth has none. Now, many people were standing there, mouth open, fast breathing. And the other thing is, those individuals who might have been on that tube, who were infected, if they were standing there with their mouth open, there's 42% greater water loss out through the mouth. So they're emitting greater waterborne particles into the atmosphere if the virus, and I think by now, I think it's been accepted that it is a virus that's transmitted airborne via water particles. Nasal breathing is very important. It would have been really, really good if, in addition to telling people to wash their hands, also to tell them to breathe through their nose, and especially people who might have the symptoms of it. And we've had many, many people with COVID, long COVID, practice the exercises. I put all of the videos out in March of 2020, and I put it out for free. I did a podcast, but it was oversubscribed. It's a dreadfully produced podcast. The lighting is poor. I was nervous going onto it. Everything was wrong about it. But I said, should we put it out there now? And we put it onto YouTube. It's had 1 million views. And many, many people will talk about, they have comments then that they've practiced the exercise. So if anybody is having COVID or long COVID, I've put all of the exercise up on YouTube, so it might be help. And nitric oxide is a gas that can help with that. So coming back to nitric oxide is also produced in the blood vessels. And this is influenced not so much by our breathing. So back in 2015, when I wrote the book, The Oxygen Advantage, I was putting the relationship that possibly nasal breathing and nitric oxide, because nitric oxide is coming into the lungs, could it be passing into the blood? And nitric oxide is a vasodilator. But if I was to write it again, and as I did in other books, I have omitted nitric oxide in the blood vessels, and I've only focused on nitric oxide in the airways, because we can say that nitric oxide in the airways is isolated to the airways. Now, but erectile dysfunction is common with men with poor breathing during sleep. And every man should wake up with an erection in the morning. It's a really, really important sign. But if a man, for example, has sleep disorder breathing, including insomnia or snoring or obstructive sleep apnea, he's not likely to wake up with an erection. And if that persists, the lack of an erection can point that there's something else going on in the blood vessels. So it's worth delving into. But I think, getting the mouth closed is really, really vital during sleep. And 50% of individuals will be waking up with a dry mouth in the morning. So I'd always say to men, you should be waking up with your lips together. Your mouth should be moist, your tongue resting in the roof of the mouth, and you should have a hard on. And that's really what it should be. Now women, of course, we want women waking up with the mouth closed and tongue resting in the roof of the mouth. And sleep disorders don't affect so many women. Well, insomnia does, but obstructive sleep apnea doesn't until post-menopause. And post-menopause, sleep apnea can affect, or can increase 200 to 300% in the female population. Wow. So that's another question, in terms of females with panic disorder, they are 2 to 3 times more likely to have panic disorder. They're 1.5 times more likely to have temporomandibular joint disorder. And the breathing for females is fundamentally different to the breathing for males. And this has been known since 1915 because of the menstrual cycle. And post-ovulation, during the mid-luteal phase, there's an increase in progesterone and estrogen. Progesterone is a respiratory stimulant. So breathing becomes harder and faster. And as breathing becomes harder and faster, carbon dioxide levels can drop by as much as 25%. But this will contribute to increased pain perception, reduced pain thresholds, fatigue. And there's quite a few studies on this looking at women with fibromyalgia. Those that meet the diagnostic criteria for fibromyalgia during the mid-luteal phase, but they don't meet the diagnostic criteria in the early stages of the monthly cycle. So then we have to ask the question, is the relationship between hormonal changes and the change in breathing and the changes in blood gases? And those papers are there. But unfortunately, Alex, breathing just does not get studied the way it should get studied, you know? And the other thing is that I think that's really held it back is that there was so much woo-woo about breathing. You know, people who were talking about it and making claims, etc. And it's really put it too much of a left of field, and breathing shouldn't be, because it is one of the most vital functions in the human body. And it is probably the most vital function, because the more important the function, the sooner the organism perishes when it's switched off. And if we were thinking about food and thinking about water and thinking about air, you know, we can only last for a few minutes without air. So it is an important function, and many of us don't breathe correctly, you know, that's just the way it is.
Yeah, so I was going to actually ask at the beginning and completely forgot around sort of stats, you know, certainly maybe in the UK, if there are some specific to here, what are some of the stats in regards to dysfunctional breathing?
A Cochrane review in 2013 had looked at the general population and concluded it was 9.5%, but I have to feel it's higher than that. In the asthma population, in different studies, it was quoted as being 30% of the asthma population. In the anxiety population, it was between 75 and 80%. In the lower back pain population, 50%. And sleep disorder breathing, sleep apnea, focusing in on that has changed since 2013, because traditionally sleep apnea was seen primarily as an anatomical issue. The airway was too narrow. And as a result, breathing was stopping during sleep due to collapse of the airway, either partially or wholly. But since 2013, researchers have identified that there's 4 characteristics in sleep apnea. And one of those involves loop gain. And basically it points to that if an individual is breathing hard and fast during the day, and if they have a strong sensitivity to the gas carbon dioxide, which is the main trigger or stimulus to breathe, 30% of the sleep apnea population have what's called high loop gain. They have dysfunctional breathing. Now, the interesting about this is that anatomical interventions then don't work for this group. So people who are using mandibular advancement devices or surgery, it won't work for this group, because the problem is high loop gain. And this is where breathing exercises can play a role. So yeah, it's really depending on the pockets of the population. And one way to screen for breathing pattern disorders is to use breath hold time. So we've been using the BOLT, the body oxygen level test, we call it. This is when the individual is sitting down for about 5 minutes with normal breathing. They take a normal breath in and out through the nose, and they pinch their nose and they hold their breath. And they are timing it in seconds until they feel the first definite desire to breathe, and then to let go and to breathe in through the nose, and the breath should be normal. But there was a professor of physical therapy who looked at 51 individuals in 2018, and he looked at their breathing from a biochemical point of view, a biomechanical point of view, and a psychophysiological point of view. He concluded that an easy way to screen for breathing pattern disorders is breath hold time, and it was the BOLT score or the control pulse from Buteyko. And his conclusion was that if the BOLT score is above 25 seconds, there is an 89% chance that dysfunctional breathing is not present. Now, if we were to look at the modern population and measure the BOLT scores of 100 people, I would say at least 30% are going to have a BOLT score of less than 25 seconds, and possibly it's higher. So while the Cochrane review established dysfunctional breathing in the population at 9.5%, it's likely that it's higher.
Okay, and I'd have to say that based on sort of my client population, I think it's over 50% comfortably. You know, talking about people with sort of chronic stress, anxiety, they have diagnoses like fibromyalgia, chronic fatigue, but also working with a lot of people with histamine intolerance, where a classic component of that is kind of just sinus issues. So again, there's kind of, as you say, a lot of bidirectional pathways whereby various imbalances feed into other imbalances. And I certainly know in my experience of taping my mouth, which obviously is something you kind of advocate for, I, to begin with, would wake up somewhere around sort of 2 a.m. with a real sense of air hunger. And initially I had to take the tape off and kind of go back to mouth breathing because it was just the familiar, it's what I was used to. Whereas now, you know, obviously I can go through comfortably with the nose breathing with the tape on, and it's just transformed how I feel. And you mentioned earlier, there might not be as much research yet compared to other areas of health and physiology, but just look at all of the people commenting on, you know, your YouTube channel and podcasts you've been on, whereby things like their brain fog has completely resolved by taping their mouth. Such a simple thing. And one thing I wanted to ask you, actually, I mean, I even wrote this down to remind myself, was, do you find that the simplicity of this almost sometimes is a barrier for people initially, until the penny drops and like they hear you speak for 45 minutes? It's almost like, I don't believe it. I don't believe that breathing differently is going to have that much of an impact.
Yeah, the first thing that I'd say about the tape is that we do have a tape that might be a little bit easier for people to tolerate. It's called MyoTape. Now, it's my own product, so I'm not here to plug it, but we developed it initially for children because we always wanted to try, how do we establish nasal breathing with children? And we give them the exercise to open up the nose, and then the tape, but the tape surrounds the mouth, so it doesn't cover the lips, and it's relatively inexpensive. It's $25, which is about what, £20 maybe, for 3 months supply.
Okay.
Why has breathing been held back? I think it was because it was being taught very wrong. It hasn't been taught correctly at all. And, you know, if you look at the individuals going to a studio now today, and the instructor will be there telling them to take these full big breaths in through the nose and out through the mouth. And that's, you know, that's, whereas should they be doing it differently? Or at least, should they be explaining that if we're breathing this full big breath in through the nose and out through the mouth, do it lightly, do it silent. You know, there's no point in just honing in on the biomechanics and sacrificing the biochemistry. And that's probably another reason, Alex, why breathing has been held back. It's been taught by gurus mainly over the years, and the guru is the guru, and the disciple or student doesn't want to deviate from what the guru has told them. But the guru could be focusing in just on one dimension of breathing. Like, for example, I give you this, you know, breathing is more complex. It's multidimensional. So with Buteyko, my own background was Buteyko, which is focusing primarily on the biochemistry. But for many years, I was guilty. I was focusing primarily on the biochemistry. Now, I remember giving trainings in Ireland post-economic crash between 2010 and 2013. 3,000 people attended over small groups over the course of the 3 years, and 90 to 95% were females. And in my head, I was asking, where are all the men? Why aren't men doing breathing? So that's why I did Oxygen Advantage. So I completely come up with Oxygen Advantage as a high performance breathing technique to improve physical performance and mental performance. But coming back then, with Oxygen Advantage, there's no tradition and I'm not constrained. So now we use 26 exercises with Oxygen Advantage. Whereas with Buteyko, I can't change the Buteyko method. I didn't develop that, you know, and I can see and I can understand then that anybody who's in the same space of breathing, that they do have their guru and, you know, they have a lineage there and they don't want to go outside of that because they might feel that they are betraying their guru. However, it has held breathing back.
Interesting. Yeah, I'm really interested in the conversations that happen. I listened to you and James Nestor talk about you know, his experiences coming from that sort of non-biased perspective of just kind of curiosity and investigation, and him doing holotropic transformational Wim Hof. And it was interesting hearing his sort of, I think, just really healthy approach to it, which is they all have a role to play within specific contexts, but what we're talking about today is kind of your breath to breath, moment to moment. This is what we're looking for ultimately.
Yes. And the other thing is, I've made plenty of mistakes with breathing, and with chronic fatigue syndrome, I've had people come in, I've given them breathing exercises, floored them completely. With people with panic disorder, I put them into panic attacks. And, you know, that experience has taught me that if I'm working with people with chronic fatigue syndrome, or if I'm working with people with anxiety and panic attacks, I have to consider that the autonomic nervous system is taxed. And I want to give a really, really, really gentle approach there. So if, for example, if one has, say, for example, chronic hyperventilation syndrome, does it make sense to give them stressor exercises? Because a stressor exercise is a long breath hold or hyperventilation techniques. And if it was my family member, I would not give that person with chronic fatigue syndrome or with panic disorder or high anxiety, I would be very, very afraid to give them a stressor exercise. There is a time to give them a stressor exercise, but that could be 3 or 4 months down the line. What I want to do is I want to get recovery in first. And with chronic fatigue syndrome, and also with long COVID, long COVID is worse than chronic fatigue, in my own experience. When you're working with somebody with severe chronic fatigue, of course, it's so debilitating. And some people, we had to do it via Zoom into their bedroom because they weren't able to get up out of bed. But long COVID is even worse from a breathing perspective. I've seen both scores of 3 and 4 seconds. Wow. The individuals also have postural orthostatic tachycardia syndrome. They can't stand up or sit up because their heart rate jumps up. And they have no idea when it's going to be a good day or a bad day. They can't project recovery. And the other thing that I would say is that anybody when your autonomic nervous system is in that imbalance, go very, very gently. And whenever you finish a breathing exercise, you should have the energy to do that exercise again. In other words, don't push yourself to the point that you're exhausted. The most simple breathing exercise that we start off with this group is small breath holds. And you'll find them free on YouTube. And also, as I said, if somebody has chronic fatigue syndrome, if they want to look at all of the breathing exercises, watch the video that I did on long COVID, because it's the exact same approach. How do we stimulate the vagus nerve? And a gentle approach. And don't feel that when you have chronic fatigue syndrome that you want to make quick progress. No, allow it to happen and give yourself at least 6 months when you're applying breathing, of course, with what you're doing as well and other modalities. And I think it definitely needs a multifunctional perspective here for recovery.
Yeah, I think the thing that comes up for me there, especially with that type of client, is it's kind of, at least initially, almost less about doing and more about being with the breath. Yes. Sort of almost just that mindfulness of, okay, how am I breathing? And that might even be, I imagine, step one for someone who's that debilitated.
Yes, and nose breathing. And then, for example, we would do some humming. So take maybe a soft breath in through your nose and then just humming on the exhalation. And small breath holds to help stimulate the vagus nerve. Everything is so gentle and so calm, and relaxation, of course, as well. Nasal breathing during sleep. And it's about a progressive build up. So when the person then is making progress, after a week or 2, we can bring in another different exercise and we can take it from there. And the other thing that we would do is, I would much rather do, say, 5 minutes every hour. So it's incrementally over the day, as opposed to sitting down in the morning time and doing a half an hour straight off the bat. Just gently working with it.
Okay, brilliant. And I think, I'm mindful of your time, Patrick, and there's a quote in your book, The Oxygen Advantage, and it just says, efficient breathing means that fewer free radicals are produced, reducing the risk of inflammation, tissue damage, and injury. And that really stood out to me, because obviously, certainly in sort of the nutrition, functional medicine, wellness space, obviously over the last, let's say, decades, inflammation is the hot word. Inflammation is kind of the mediator of most of these chronic complex diseases that we see in the modern world. And again, it comes back to this idea, there's been a lot of awareness around food and the role that plays. Over the last 5 years, sleep has been like the big new topic. I like to think breathing is becoming the next one. But just to kind of hit home that, the way we breathe is influencing the immune system, it's influencing oxidative stress, which are just such big components of whatever condition you want to talk about ultimately. So I think it's a pretty powerful quote for everyone just to be aware of ultimately.
Yeah, with inflammation, there's not a whole lot of research looking at over breathing contributing to oxidative stress. There's some studies that are looking at breath holding, using that as a means of oxidative stress. I think the biggest role in terms of breathing and inflammation is looking at stimulating the vagus nerve. And this stems back to the work of a neuroscientist called Kevin Tracy back in 1998. He stimulated the vagus nerve in the rat, and he found that he could block many pro-inflammatory cytokines. And then he moved on in humans, stimulating the vagus nerve for people with rheumatoid arthritis. There's a huge opening there, because if one stimulates the vagus nerve, and albeit some people are doing it electronically, but you can do it via the breath. And this is where either light breathing, so softening your breath to the point of air hunger, can stimulate the vagus nerve. Slow breathing, slowing down the respiratory rate down to between 4.5 and 6.5 breaths per minute. Low breathing with optimal movement of the diaphragm. Nose breathing during sleep. All of that can help to stimulate the vagus nerve. And this is an area that really needs more research. It's crying out for research, because so many conditions and chronic stress is playing a role with contributing to inflammation. And the one thing about the breath is that you can help to counter the effects of chronic stress, because you can help to bring the body back into balance. And by switching on the vagus nerve, and none of this information, again, Alex, is new. 1913, it was known that if you stimulated the vagus nerve, it secreted the neurotransmitter acetylcholine, which causes a slowing of the heart. And when the heart rate slows down, the brain is interpreting that the body is safe. So I would really encourage people to look into these very, very gentle exercises to help with recovery. And I think it's a part of it.
Yeah, definitely. Fantastic. Is there anything, Patrick, that you want to kind of conclude with, or anything that you want to sort of re-emphasize before we close?
I think it's paying attention to the breath, number one. And, ask yourself the question, are you waking up with a dry mouth in the morning? How do you feel? Are you walking down the street with your mouth open? Are you breathing harder and faster using the upper chest? Can you hear your breathing during rest? Do you have a stuffy nose? And just to bear in mind, ask what's happening when you have a habit of breathing mouth harder and faster. It's not as if you're having a panic attack, because this is why it gets overlooked. But that mouth breathing and faster breathing and harder breathing is switching on a greater sympathetic drive. And to get into balance, then do the opposite. And when I'm explaining it with students who come in first, I always ask them, I say, how do you breathe when you get stressed? So when you get into that difficult situation and you're feeling stressed, how does your breathing go? Does your breathing get faster, or does it get slower? Does your breathing be upper chest, or does it be lower? Do you have irregular breathing with more sighing? When you're getting stressed, you're sighing more, irregular breathing, or do you have regular breathing? Do you have harder breathing when you're stressed, or lighter breathing when you're stressed? Are you breathing through the mouth when you're stressed, or nose? And they will typically say that when I get stressed, I do notice that my breathing gets harder and faster. I'll sigh more, I'm mouth breathing, and I'm feeling air hunger. And then I'm saying, okay, well then how do we bring the body into relaxation? We have to do the opposite to the stress response. Instead of breathing faster, slow down your breath. And you could time it if you want, but when you're timing breathing, don't be taking these full big breaths either, because you don't want to slow down breathing but sacrifice the biochemistry in the first place. So instead of breathing faster, breathe slower. Instead of breathing high, breathe lower. Instead of breathing mouth, breathe through your nose. And instead of breathing irregular, breathe regular breathing. And by working on your breathing and improving your BOLT score, that will actually start coming into place. And sometimes that's the best way for people to understand it, because they then get what dysfunctional breathing is. How we breathe when we're stressed is the same breathing pattern as somebody with dysfunctional breathing. It's not just that the difficult situation changes our breathing pattern, but dysfunctional breathing is feeding back into that response.
Interesting. The sighing was a big one for me going through this process, noticing just how often I used to sigh. And I've noticed Katie, my wife, actually still does this a bit sometimes on especially a stress day, as a really sort of powerful inhale, like there's just a really loud, audible. And it's so interesting how you start picking up on these things that normally just fly under the radar. So I think all of what you've just listed there is such a great way of just becoming mindful of the breath and understanding kind of what's going on from that perspective. One final question, Patrick, let's just come to mind. I don't know, I'm sure there won't be research here, but just your own thoughts maybe on, can there just be a behavioral transgenerational element to this? Because I think of my mum, and I think I picked up certain breathing habits from her, for example.
I think there is. I definitely think there's a genetic predisposition. McGurk is a researcher who was looking at the ventilatory response to carbon dioxide in athletes and concluded that there is definitely an inherited predisposition, but it can be trainable. However, I have seen it in families whereby breathing patterns are the norm for that family, breathing pattern disorders, that the individual who is then training their breathing, it can just take a little bit of work, but it's totally trainable. So don't let that put anybody off.
Excellent. Patrick, thank you so much for sparing the time. I've been eagerly waiting to speak with you and to share this with our listeners. So thank you very much.
Pleasure. Thanks, Alex.